Well, Leader, thank you. We thank the President. This was very gracious. We were going to recommend we do this every Tuesday here at the White House for having lunch. But the President was enthusiastic about where we are and what we've accomplished. And let me just echo the Leader's words and the President's strong suggestion, obviously, and that is that we get this job done. As the Leaders pointed out, 4 of our 5 committees have acted. I have a lot of confidence in the person standing to my left immediately, Max Baucus, who's been through a Herculean effort here to reach a bipartisan agreement in the Finance Committee. I'm confident we can get that done with Max's leadership, leading the Health Committee in Senator Kennedy's absence. We're ready and willing, of course, to sit down and meld our legislation to begin the work with the House. The process is a dynamic one. It's open. We're welcoming people who want to come to our table and share their ideas, whether they be Democrats, Republicans, nurses, doctors, the insurance industry, the pharmaceutical industry, others who have ideas they think can help improve and strengthen our efforts. We welcome that participation, but we're determined to get this job done. We're going to be gone for a month. In that month that we're gone, 500,000 people will lose their health care coverage in the United States, 14,000 people a day. We need to come back with a renewed sense of purpose, that we're going to do everything possible to bring that sense of certainty and stability to the American public, that they no longer have to worry at night as to whether or not they have the coverage or the opportunity for care if they get into trouble. Many of you may know I'm going to go through some surgery in a few days. I have a great health care plan. I've never worried about whether or not I had a health care plan or I could get good care when I needed it. My case shouldn't be any different than any other Americans. When they get sick or need help, we ought to be able to get it in this country. Just because I'm a member of Congress and have a good federal health care plan doesn't mean that others shouldn't have that sense of security and confidence as well. And I'm confident that we Democrats and Republicans, if they'll join us, can get that job done.